Today on MedTalk, we celebrate our first anniversary with a medical outreach program here in the San Juan Covered Court. Joined by numerous doctors, nurses, and local health workers to provide medical assistance to our kababayans. Now at a new 1-hour time slot and the new home, RPN Channel 9, we discover that healthy living is not as difficult and complicated as you may think. I'm Angel Jacob, and this is MedTalk. This episode marks MedTalk's first anniversary. And what better way to celebrate than with a medical outreach program in the San Juan Gymnasium. Together with volunteer doctors, nurses, and other health workers from the Department of Health, Red Cross, and other organizations, MedTalk provided free medical assistance and advice to our kababayans. Our expert doctors were all here on site to promote general public health awareness, offer free consultation services, and medicines to those in need. Tonight, we also discuss various topics related to some of the most common health problems experienced by Filipinos today. All these and more tonight on MedTalk's first anniversary special. Joining us tonight is Dr. Maria Victoria Pilares Cruz, a national board member of the Philippine Academy of Family Physicians. Also with us is Dr. Elmer Labella Jr., Pediatrics Department of the Rizal Medical Center, and Dr. Valen Ko, OB-gynecologist from the Chinese General Hospital. Good evening, doctors. Welcome to the show.
Good evening, Angel.
Good evening. There's this general thinking that individuals or Filipinos or anyone in general, they just go to the doctor when they feel something already. Hindi yung they'll go, pagka may nararamdaman silang slightest, they'll prolong it first, mag-aantay sila, they'll seek advice from someone else instead of going to their doctor. Why do you think we have this kind of thinking?
Maybe they are afraid of discovering something, or probably in the medical system that we have to shoulder everything. So sometimes the adults, they tend to sacrifice a little for the young ones, and that may be the reason.
I share the same opinion as Dr. Ko. Actually, if you go to the doctor, you're usually afraid you might open a Pandora's box. You might discover you have a lot of diseases. And then, of course, to be able to diagnose them, you have to undergo a lot of workups. And in the Philippines, Filipino families have very little, they set aside very little for their health needs. And mostly the expenses are out of pocket. Even if we have PhilHealth, it does not cover 100% of their medical services and expenses. So that could be one of the reasons, no? Financially also, financial difficulties.
Pero di ba more often than not, when we delay going to the doctor and when we go, they find something else aside from your complaint, aside from that medical complaint of yours. What can you say about that, Dr. Bell?
I think that it's just that it's the stigma in this in the community, where when you go into the hospital and you find all these different sicknesses, it will be added expenses to the family. And sometimes, like here in the Philippines, a lot of families would rather just go through the sickness, and they think gagaling naman siya kahit ano. And a lot of families also self-medicate, so they don't have to go to the doctor kasi hassle eh. You spend for the fees, for doctor's fees, you spend for labs. Unlike if you just go ahead and buy the medications na previously prescribed to the kid, it will be a lot less expenses for the ano. So I think that's why also I agree with sila doktora kasi yun nga expenses, financial constraint talaga.
Pero 'di ba makakatipid naman sila. They can save up on more medical expenses if they go immediately.
Kaso yung pinaka short-sightedness nila is yung kakopyahin ko na lang yung ginamot dun sa kapitbahay ko. Yung ganon. So, baka gumaling rin naman ako. Yun. So, I'm not thinking na in the long run, baka it won't work. Pagka it won't work, di at saka na lang ako punta sa doktor.
So speaking of consulting, now it's time to consult. Which are or what are the more common or the most common medical issues that Filipinos face? Let's categorize it into the wet and the dry season because we have the summer and now the rainy season. No? How about let's start with the dry season during the summer. Ano yung most common illnesses or virus that we can get? Torako?
Actually,
Dr.
if
Pelaez.
you talk about common diseases in the Philippines, we actually have these 10 leading causes of morbidity. So this is nationwide. So the most common, or at least even 8 out of 10 of these leading causes of morbidity are actually infectious diseases. You have diarrhea, pneumonia, bronchitis, measles, chickenpox. The only non-infectious diseases there, I think, are hypertension and diabetes. And so we really have to deal a lot with infectious diseases. Viruses are just one of the several etiologic agents for infections. Aside from that, you have also bacteria, parasitic infections, etc.
And this happens all year round. Walang pinipiling season.
Yes,
Whether it's
but
summer
of course
or
it's
the
more
rainy
common
season.
during the cold seasons or during the wet and cold seasons. That's why, for example, for patients, we have to immunize them before the cold seasons or the rainy seasons. So you give the influenza early on during the year so that you can protect them. During summer seasons, well, you have, of course, heat stroke, heat-related problems, you have rashes, etc. Those who go on outings will probably be more prone to diarrhea because they may go to
UTI is
places.
one.
Yes,
Yeah,
UTI.
So how about the difference between the colds and flu, which is also all year round? Anyone can get it all year round. Dr. Ako, colds and flu?
I think it's more of nomenclature or the severity or the extent of the symptomatology. Colds and flu, I think it's just gradient, I think. Okay, so cold, you just have running nose. Flu, you have your fever, your muscle pains and all that. But basically, it's the same.
The etiologic agents for colds usually have the rhinovirus, adenoviruses, while for influenza or flu, as we call it, you have the influenza virus. Again, the symptomatology is different. So you have milder symptoms in colds. Usually it's runny nose, stuffiness, and you may have also dry throat. You can develop cough. But for influenza, the symptoms are fever, you have body malaise, you have muscle pains, and so the duration of illness for flu may last for 1 to 2 weeks, but it's still of viral etiology.
So a viral infection, do we need to see the doctor right away?
I think there are differences kasi if to treat viruses and bacterial infections. Although it's really hard sometimes to detect if the patient has a viral or a bacterial infection. One, because the main etiologic agent causing the sickness, like bacteria, can be killed by certain drugs like antibiotics and as opposed to viruses, which cannot be killed by antibiotics. It can all be cured by the body's resistance itself. So when we have proven through tests like complete blood counts, there are other serologic tests that we can do to the body. If you have proven that it indeed is bacterial or viral, the treatment is really different. Viral infections usually last shorter as compared to bacterial. Although it also depends on the body's resistance. So kung mahina yung bata, the sickness will persist. So basically, yun lang yung one of the things that we would like the public to avoid is the uncontrolled use of medications na when they self-medicate. That's why it's also really important to always go to the doctor when when you don't feel well. Kasi hindi mo alam baka viral, baka bacterial, baka iba. So it's always better.
Towards the Christmas season, what are the more common, how do you say, viruses or illnesses that one can catch during this season?
Colds, I think. Colds.
Colds
Common,
and
ano,
influenza.
colds.
That's why we encourage especially extremes of ages, the very young and the very old, because they are the ones who are more prone to the complications, especially of flu, which is pneumonia, and that is what we would like to prevent through adequate flu vaccine. No? Sila yung madaling mag-progress into pneumonia if they develop flu. Yung very young, especially the patients of doctor who are pediatric patients, and of course the elderlies or the geriatric patients.
I think we have a question from our audience.
Magandang gabi po. Ako po si Cecilia De Leon. Ngayon may problema po ako sa warts na tumubo dito sa farm ko. Siguro it takes 3 months na ito. Dati na follicles lang ito. Maliit lang nung dumapo ito sa akin. Ngayon habang tumagal, umabot ng 3 months, eto na siya, lumaki na. Ang problema ko kung paano siya matatanggal, may gamot ba o papay dito para kung sana siyang matanggal o gagamitan pa ako ng mga electricity katulad na sinasabi niya electrocautery, yun daw makakapagpatanggal. Takot ako sa ganon, masasaktan ako. Gusto ko yung something na baka may ointment o cream na ipapahid dito, doktora.
So, ang warts po kasi, kailangan nga po talaga sunugin. Electrocautery po, para po masunog hanggang dun sa base ng warts. Kailangan po sunugin yon, pero hindi naman po kayo kailangan dumanas ng sakit during the procedure. Usually po nilo-local anesthesia din po yung area na kailangan i-cauterize. So hindi po kayo kailangan i-torture during the electrocautery. Okay? But topical meds po usually won't work as well as electrocautery. At saka kailangan din po kayong i-advise na malamang din po yung mga warts din po. Pabalik-balik din po kasi yan. At saka minsan, hindi lang yan, meron din kayong mga maliliit. So, mas maganda po talaga electrocautery.
Salamat po. May iba po pong tanong? Opo.
Good evening po.
Good evening.
Gusto ko lamang pong itanong, kung ang isang tao po ay tinutubuan po ng mga lymph nodes or kulane sa different parts of the body, like sa leeg, kilikili, mga singit, ano po bang ibig sabihin nito? Is it a sign na meron po bang problema ang isang tao? At the same time, ito po ba ay kinakailangang ipa-opera?
Kasi ang kulane, yan yung mga collecting system ng katawan natin sa mga sira na parte. Okay? Usually yan, pagka may sugat ka, yan, magkakakulani ka dun sa joint na above it. Okay? Kung merong infection, may sira ang ngipin mo, magkakakulani ka dito sa ilalim ng leg mo. Meron kang sugat sa kamay, sa kilikili. Yun yung, kasi sila yung nagkokolekta ng mga debris. Yan. Kaya lang, kung different parts ng katawan mo, ibang usapan na yon. You have to consult a doctor na. Kasi it might be something different na. Kasi ang cancer rin, nagpo-produce rin ng kulane sa iba't ibang lugar ng katawan. So, kung yung partial lang, yung ano lang, mild lang, usually it's treated with antibiotic lang. Okay? Para mawala lang yung infection, yung inflammation, inflammatory process. Pero kung persistent na siya at kalat, then I think you need to seek further consultation.
So, doctors and to our audience, MedTalk will just take a quick break. When we come back, we'll talk about diabetes and hypertension. All these and more on the first anniversary special of MedTalk. We're back here on MedTalk at the San Juan Covered Courts, where we celebrate our first anniversary with a medical outreach program. Now, this time, doctors, we're going to talk about hypertension and diabetes. Let's start with hypertension. What is the normal blood pressure of a healthy individual?
Okay, what's considered normal now is below 120/80. We follow a certain classification for blood pressure, which is the JNC7. Okay, so it classifies blood pressure into normal, pre-hypertension, stage 1, and stage 2. So a normal individual should have a blood pressure of less than 120/80. If your BP is 120/80 to 89, you are already considered pre-hypertension.
That's 120
Yes.
over 89.
Yes.
But does it depend on the activity? Maybe one has been stressed or one did a very rigorous activity kaya nag-fluctuate yung kanyang blood pressure, but not necessarily na ganun ka-consistent yung pagtaas ng kanyang blood
Yes,
pressure.
we don't really diagnose hypertension with just one BP reading. So it should be several occasions. Take the BP at several occasions. You don't label a patient as hypertensive if you just took the BP once, especially kung pagod siya. You have to have the patient rest. Like if you see a patient in your clinic, kakadating lang niya, naglakad pa siya ng malayo, kukuhanan mo siya ng BP, naturally it's going to be high. So you have the patient rest about 10 minutes before you take the blood pressure. And then you have to determine whether is that the usual trend in his blood pressure before you actually label the person as hypertensive, pre-hypertension, or if it's stage 1 or stage 2. The higher the blood pressure, the higher the label of the staging.
So you mentioned stage 1 and stage 2, and you mentioned the word higher. So how does the individual detect na tumataas na pala yung kanyang blood pressure? Or what are the warning signs that our blood pressure is already going up? Torako?
Actually, yung warning signs is very deceptive eh. Kaya kailangan you really have to have your regular checkup with your doctor. Sometimes you don't feel anything, pero blood pressure mo is way up high na. Ceiling high na. Sometimes naman, konting hilo-hilo, nasa 140 level. Okay? So, tightness dito, nasa 140, 150 lang. Pero yung iba, nasa 190, 200 na. Asymptomatic walking pa. Okay? So, very unreliable to depend on symptoms, things that you feel. Kaya dapat talaga regular check-up.
How regular is regular when one does get your blood pressure checked?
I think regular checkup, a patient could go in about in a span of a week, every week. It depends. If the patient has a very dangerous blood pressure, he could see the doctor at least every other day, depending on how severe nga yung blood pressure. I don't know about my patients, but
Yes, for children, in the pediatrics department, meron bang tumataas ang blood pressure? Are you able to monitor kids with high blood pressure?
Yun nga sabi ni doctor ko earlier. For kids with juvenile diabetes, children who have diabetes in an early age, nagkakaroon kasi ng high blood pressure yung mga bata because the sugar in the blood gets too concentrated. The blood becomes thickened. Kaya as it goes through the blood vessels, nahihirapan na yung katawan natin, yung katawan ng bata for the blood to flow around.
Sa kidney,
Oh, the kidney problem.
Kids with kidney problem, nephrotic syndrome, and all
one purpose
that.
of the kidney also is to filter our blood. And also, yung pinaka-salt concentrations ng katawan, yan yung nagko-control kasi ng blood pressure also in the body. That's why yung kapag sinasabing may hypertension, iwas sa maalat, iwas sa matataba. Because salt is a very important mineral in the blood na controls also hypertension. And since if the kidney is kung may mga kidney problems, hindi nakaka-excrete ng salt yung katawan ng maigi. Kaya nagkakaroon ng hypertension.
So sa hypertension, we should stay away from salty foods
Salty, fatty foods.
and fatty
yeah.
foods. Sa diabetes naman, we should stay away from sweets
Carbs.
and carbs. Oh no, di ba ang sarap pa naman to eat sweets and carbs, di ba? Favorite. We always have to have dessert.
But
But
Christmas is near.
yeah, Christmas
All
is
the
near, and
carbs.
everyone will will shower us with sweets for the holidays. So how do we enjoy these sweets without the fear of getting diabetes?
Probably with proper exercise, you have to
Yes.
burn them.
And always eat in moderation.
Stay in your seat, be a couch potato,
Yes.
watching TV, playing computer.
Oo, basta movement is
Moving,
very
yes.
important.
Yes, stagnancy is really one of the #1 killers today in a lot of people, lalo na yung mga may diabetes.
So we talk about the treatment. How about the diagnosis? If you already have diabetes, how does this go? How is one diagnosed?
Of course, patients may also report some symptoms like the 3 Ps, polydipsia, polyuria, and polyphagia, which means gusto niya parating umiinom, parating uhaw, parati siyang nawiwiwi, and also gusto niya parati kumakain. And despite taking a lot of food, sometimes they also lose weight. There are diabetics who are obese. There are also diabetics that are non-obese. So, and if patients would report that, of course, on the background also of a very strong family history, diabetes should always be considered, and patients should be screened for diabetes. We have diagnostic tests, of course, the fasting blood glucose determination, and also we sometimes also use the glycosylated hemoglobin. Again, this is another blood examination to determine the average level of blood sugar for the past 3 months. This is done also as a screening and also as monitoring for diabetic patients.
I also yes, Dr.
And
Koy,
one
you'd
more
like to
thing I
add.
want
Yes.
to stress in pregnancy, okay? So we tend to forget about diabetes. In the past, we don't put so much importance in diabetes in pregnancy. But now we have correlated that poor pregnancy outcome can be due to diabetes. Okay, so because this high blood sugar is very teratogenic to the developing fetus inside. So part of the screening test, part of the laboratory workups during pregnancy is doing a sugar test. And it's not just fasting blood sugar. It has to be emphasized that there should be challenge. Sometimes these mothers just do their own laboratory, having a fasting blood sugar, but it's not enough. There should be a challenge test to screen diabetes in pregnancy.
So when let's say the mother has been diagnosed with diabetes, will she pass that on to her baby?
No, actually, it's a hereditary thing. Okay, not necessarily that I have diabetes, my baby will have that diabetes. But I have to have proper control for my baby to develop well. Okay, so even the lung maturity is affected by my high blood sugar if it's not properly controlled.
We talk about diabetes. I understand there are 2 types of diabetes. Please orient us or inform us about type 1 diabetes first.
Okay, you have the type 1, which is the insulin-dependent diabetes. And then you have the type 2, which is non-insulin dependent. Most of the type 1 patients are younger patients. You have the juvenile diabetic patients. This is basically a problem per se in the production of insulin. So meron na sila agad problema with regards to the pancreas and the production of insulin. The type 2 diabetics are usually those that may have insulin but they cannot utilize the insulins to process the sugar that they're taking so that it can be processed in the body and used by the body. Or sometimes they have receptors, we call these receptors, and they also do not respond to the insulin that the patient already has. So the treatment for type 1 is usually, you usually start with insulin because that's the basic problem. So you give the insulin. But for type 2, which may be the insensitivity of the receptor or the low levels of the insulin, you can actually use your oral treatment, your oral hypoglycemic agents to lower your blood sugar. And of course, if they do not improve or the blood sugar is not controlled, you can also put them on insulin much later on.
Thank you, doctors. Now we have a question from our audience. Ay,
Magandang
aba.
gabi, Doc. Ang hypertension ba may pinipiling edad pagka nakakasakit nito?
Salamat.
Okay, hypertension, pwede po kahit anong edad. Pero karaniwan po yung mga may hypertension na bata pa, nagkaka-hypertension na, malamang po meron silang mga ibang problema. Meron po kasing dalawang klase ng hypertension. Yung po yung primary at saka secondary. Yung primary po, usually yun yung pagka nakakaedad ka na dahil marami ng tumataas na talaga BP mo. Pero yung pong secondary, yun po yung mga bata pa, nagkaka-hypertension na.
May question
Yes,
po?
magandang gabi po. Ano ba ang dapat na mabuting gawin para maiwasan ang vertigo?
Meron po minsan problema sa mga daanan ng sa blood vessel po, tinatawag nating vertebral artery insufficiency syndrome. Okay, pwede pong related doon or pwede rin din pong related sa problema po sa tenga. Kasi minsan po meron po tayong mga parte sa tenga na nag-aano rin sa atin na para ma-sense natin na may balance tayo. So, kailangan po magpa-check up po kayo sa tenga, baka po may problema. Kung doon po ang problema, iba po ang management noon sa usual ng pagkahilo. Kung ang pagkahilo po kasi pwede rin maraming panggalingan, bukod dun sa sinabi ko, pwede rin pong related siya sa mga iba't ibang sakit tulad nga ng hypertension. Pwede ang manifestation nun, pagkahilo rin. Kung kayo po ay mababa ang hemoglobin or hematocrit, na anemic po kayo, pwede rin pong pagkahilo ang magiging unang simptomas nyo. So, kailangan po talaga magkonsulta sa doktor para po malaman exactly kung anong magiging diagnosis at cause ng pagkahilo po nyo.
Salamat po.
Thank you very much. When we come back, we'll talk about the importance of immunization in preventing diseases. All these and more here on the first anniversary special of MedTalk. I'm now with the doctors from the Rizal Medical Center, and this is the adult medicine table. Hi, doctor. Hi, nurses. Hi, how are you? At meron din mga pasyente, of course, who are consulting with our doctor. So, Dr. Ann, hi, welcome to MedTalk. And I'd like to ask, how has it been so far? How has this day been so far in terms of giving medicines and immunizations to the patients?
Actually, we're encountering a lot of patients, especially patients with cough and colds. So far, medicines are overflowing, actually. And then in terms of vaccines, we're able to give flu and pneumococcal vaccine, which are important vaccines, especially for cough and colds, because it helps prevent especially nowadays, yung weather natin, and then yung changing weathers kasi. So, especially the virus, it helps our immunity. So, that's it.
So what is the importance of giving the vaccine to all these patients? As I mentioned, this is the adult medicine table. So, and I've seen ang dami nang humingi ng medicines or nagpa-vaccinate. So what is the importance of doing this?
Primarily, it helps our immune system. It boosts our immune system to help fight these viruses. Yeah.
So yung common cold now that the season is changing, no? So you also have two patients here. Good evening po.
Evening din po, ma'am.
So ano pong concern nyo? Kaya kayo nandito? Medisina or kukuha kayo ng vaccine? Ano po yon?
Kinonsulta ko lang po yung madalas ko pagkahilot tsaka sumasakit po lagi yung ulo ko.
Yes, masakit ang ulo tsaka nahihilo.
Yeah, maybe because of the weather also.
So ganito po yung nararamdaman nyo tuwing ganitong panahon or all year round po yon?
Pag mainit din po, mainit. Tsaka pag kunwari nakaupo o kaya nakahiga, biglang tatayo, yun po yung madalas akong mahilo.
These are, I think, normal events, or it really happens. Lalo na pagka from bed and then suddenly you will wake up.
So nabibigla din yung system nyo, no? So I'm sure na inaalagaan naman kayo ng ating mga nurses at ang ating doktor dito. Kayo po, ano po yung inyong medical concern?
Yung sumasakit po yung ulo, saka yung ubo po, saka sipon po.
So gaya ng na-mention nyo, no? Masakit ulo, ubo, sipon, which is very common these days. Kaya you've come to the right table. Tama po tong table na to at aalagaan kayo ni Dr. Ann and our nurses. Maraming salamat.
Thank
at
you
salamat
also.
po. Pagaling kayo. Okay. Salamat. Okay, we now move on to another table. If that table was all women, this table is all men. Let's see what the health concerns of men are. Hi, doctors. Hi. Welcome to MedTalk. What are yung mga health concerns of those who have come to you today?
Mostly cough and colds, usually for lasting for 2 weeks, 3 weeks, and others about 1 month.
Doctor, you mentioned nag-progress na in 2 weeks or months yung ubo tsaka yung sapon. Do you still give a vaccine or you just give tablets for the
For
remedy?
those cough and colds that lasted around like 2 weeks or 3 weeks or if months, we usually give antibiotic na not anymore vaccines, and then medicines for cough and colds. But if it just lasted like 3 days or just days, maybe medicines for cough and colds, not antibiotics. Then we advise to maybe refer to any specialist like IM doctors or any other specialist that covers those problems.
How about the health concerns of the elderly? Ano yung mga ipinunta nila sa inyo dito?
For the elderly, they usually complain of pain on their joint pains, body pains mostly. So, and others is hypertension.
And hypertension as
Yes.
well. Okay. So yung patient nyo na nandito, good evening po.
Good evening.
Ano pong kinukonsulta nyo dito sa kila doktor?
Ano po ako high blood. Mataas po ang cholesterol ko. Tsaka mataas din ang dugo ko. Yun lang po.
So, na-address na her concern, high blood, high cholesterol, and ano pa po yung isa?
Yun lang po yung ano ko.
So, the medical attention given to her is enough already for those concerns of hers?
So we give medicine for the hypertension, and then we advise for diagnostic laboratories such as for lipid profile, those things, for sugar, just in case to make sure that maybe there would be there's a triggering factor that makes the mother hypertensive. That's it. And then for the diet also, those things.
Important, no, yung
Yes.
diet. Mami, yeah, na yung diet po. Because, on MedTalk, we always talk about the importance of diet and of exercise. Yung portion control lang. Yung pwede namang tikman lahat ng ihahain, but little by little lang po, para makontrol rin yung inyong pagka-hypertensive. Kayo po, what is your medical concern po?
Napa-check up din po ako.
Check, ano pong pina-check up?
Napa-check up ko yung ubo. Mawala yung ubo.
So, pneumonia naman yung check-up niya. So, what kind of treatment for pneumonia that we can give here during this medical mission?
The most important treatment, ma'am, is the antibiotics. Usually, pag chronic na yung cough, associated with fever, ibig sabihin may infection sa loob. So, we usually give antibiotics pag chronic.
So, yung antibiotics na for how long will he be taking
Usually,
the antibiotics?
1 week po pag antibiotics. Dapat diretso yung treatment niya para hindi magkaroon ng resistance sa antibiotics.
Okay, so after that 1 week, iigi na po yung pakiramdam nyo. Okay. So thank you very much, doctors. Maraming salamat ulit. Thank you. More health-related concerns when MedTalk returns. We're back here on MedTalk at the San Juan Covered Court. This time we'll be talking about obesity and dieting. So let's talk about obesity first. In children, is this very common? Is it common among Filipinos?
Among Filipinos, I rarely see any children come into the hospital who are really obese. Basically, I think it's because of the financial situation of most families here. But obesity in children can pose a really big threat in their morbidity and in their health. Basically because obesity, there are studies na obesity can increase the risk of diabetes in children. Also because basically obesity can cause a lot of heart problems also, especially when they grow up. So although it's not as common here in the Philippines, it still is a major problem when it comes to obesity in children.
In children kasi, when we see a healthy child or a heavy child, we often say that the child is cute, that the child is inaalagaan ng maigi. But little do we know that this child may be obese already.
So it's a very wrong misconception here when pag mataba yung bata, healthy. So here we see there are a lot of sicknesses and illnesses that can arise from obesity.
So not only sicknesses, even yung self-confidence ng bata. 'Di ba? If ever taba siya, lagi siyang tinutukso sa school, 'di ba? Yung kumpiyansa na sa sarili niya nawawala.
So hindi lang siya physical pero meron siyang mental and emotional
Stigma.
stress or
Yes.
stigma, no? So this is among children. About among adults and among pregnant women, when do we say an individual is obese already?
It depends on the BMI, the body mass index, yes. And actually, the weight is not very important, but more on the BMI right now.
I always thought that you base yung basehan ng pagiging obese ng isang bata or isang tao is the weight itself. But it's not that pala.
Not anymore. And even now, they have these computations computing your visceral fats na nga eh. So not just the body fat, but the visceral fats, which is the fat that causes the hypertension and other diseases.
Even in pediatrics, there are specific charts that pediatricians base on, basing the child's height, age, weight, and when they plot it, that's where you can also find out the BMI for kids. Kasi iba yung there's slight difference when it comes to formulating the BMI for kids and for adults. So in pediatricians, in kids, there are specific charts that pediatricians follow.
Yes, the formula for the BMI is weight in kilogram over height in meter squared. But you leave up the doctor to compute that for you. And then based on that computation, you can categorize your patient as normal, overweight, Then you have also the obese and of course the underweight. The WHO has a classification for normal. The normal for under the WHO is 19.5 to 24.9. But there's also another category for Southeast Asian body types. Kasi parang yung WHO, regardless of race. Now, there's another classification for Southeast Asian body types, which are our body types. The normal is 18.9 to 22.9. So, medyo mas mababa. So, yun yung basihan ng BMI. And it's a reflection of the total body fat. That's why we no longer rely on just the weight itself, but you have to compute for the BMI as well.
Okay, so in determining if one is already obese, you really have to get these numbers.
Yes.
To compute for your
The
body
doctor
mass
will
index.
usually compute that as part of the history. Dahil kinukuhanan ka naman ng weight and height during your consultation. So they can immediately compute for your BMI classification.
But sometimes others might be shy or might just disregard having that computed because they don't want to find out. So are there, aside from, of course, gaining a lot of weight, are there other signs that can indicate that one is already obese?
It's hard kung by the looks lang. Although by the looks, you will see naman na hindi proportional yung weight niya sa height niya. There's weight for height. So that could be a warning na. And of course, if the patient is presenting with symptoms of hypertension, diabetes, usually you have a problem also of obesity. So you might as well check also the nutritional state of the patient.
Now, you mentioned, Doctora, the nutritional state of the patient. So how do we get to that healthy state, healthy nutritional state, which will not lead to obesity or obesity? Any diet tips or lifestyle change that one should adopt? Lalo na Christmas, Christmas is coming up and hindi naman maiiwasan that we yung isang tabi in Tagalog, no? Isang tabi lang all the food that we will see during the holidays. So how do we control that?
If you really want to quantify like a number on if you want to know whether your status, if you're as a healthy individual, there are a number of blood tests that you can do, like cholesterol, yun nga yung sa sugar, if kung wala kang diabetes. Well, basically, to get to that healthy state, I would say it's always just you just need to have a balance of the right amount of carbs, the right amount of fats, and the right amount of proteins. Too much fat can cause hypercholesterolemia, can cause triglycerides in your blood. Too much carbs can cause excess sugar in your too much protein can cause problems with your kidney also kasi kidneys it processes your protein. One bottom line thing that I can say to improve the diet is to just really sometimes you need to trick your mind kasi let's face it, the food that we have around us, it's not healthy.
Lahat ng kinain mo, you use it as energy so you can eat again.
Yes, if you're
Saka
average.
siguro, portion control.
Yes.
Kasi sometimes it's difficult to say na di yan pwede, masama yan. Siguro konting kurot pwede naman.
As medical experts, what do you think of cheat day? Where you can eat the sweets that you weren't able to eat the last couple of days. There's one day that you allot to eat the sweets and all the other stuff
Pero
that you
siguro
don't
not cheat day without limit. May limit rin. You can cheat, pero siguro wag naman yung sobrang cheat na. Garapal na masyado.
So it's really trick your mind. There's the discipline that you have when you're faced with everything. Like you go to a buffet setting or a setup, you see everything and you're overwhelmed.
Buffet right and left na tayo. Kaya ang health natin ngayon, grabe, di ba? Obesity, hypertension, diabetes. Kasi tend to eat kasi sa buffet. alangan namang konti lang kunin mo, di ba? Siyempre, you want to maximize everything, o di ba?
Or avoid the buffet altogether.
Yes, right.
Just do a la carte.
Kaya
You're
nga,
only
my husband always say, huwag na tayo
yourself to the
mag-buffet.
No more, just do a la carte. So you're concentrated on one meal. I think we have a question from our audience. Go ahead.
Good evening po, Doc.
Magandang
Ako po
gabi.
si Diana La Chica po. Gusto ko pong itanong yung kung ano po dapat ipapakain ko po sa anak ko pong, kasi mahina po siya kumain, tapos may pihikan po siya kumain. Yun lang po, Doc.
So, picky eater.
Yes.
May mga favorite lang sila. Ano po ang favorite ng anak niya?
Ang paborito niya po, minsan sa almusal po, kanin tsaka hotdog. Yun lang po. Napay.
Ilang taon na yung anak mo?
11 years old na po.
11 na?
Opo.
Kasi sa tingin ko yung pagkain natin, ano yan eh, sa kinalakihan mo yan eh. Okay, so kailangan tinuturo natin sa kanila yung tamang pagkain kahit bata pa lang sila. Hindi pwede yung sabihin na ayaw nila. Hindi pwede yung pairalin yung ayaw eh. 'Di ba? Tsaka gusto. Gustong maglaro sa ulan, papayag ka? 'Di ba hindi? Oh, so gusto niya ng hotdog. Ang hotdog puro salitre. Puro proseso siya. So hindi siya magandang pagkain. Kaya dapat lulutuan natin siya ng something healthy. Kasing lasa, o minsan masusarap pa sa hotdog. Kasi sometimes, yung hotdog madali kasing gawin eh.
Oo.
Diba? Convenience ng nanay eh. Diba? Oh, and like, pagka magluto tayo ng tunay na pagkain, hindi processed food, mas mahirap sa ina, sa magulang, pero konting sakripisyo. Tsaka ituro natin sa kanila kung ano yung dapat, ano yung balancing pagkain. Hindi lang karne, hindi lang manok, kailangan may gulay, may prutas, para balanse lahat.
Pero okay lang din po, Doc, na mayroong yung food supplement ng vitamins. Kung okay din po sa magpainom ng sa bata.
Oo, kasi kung sa city tayo, mahirap rin kasing sabihin na balanse, di ba? Kasi minsan wala rin tayong time maghanda ng balanseng pagkain, nagmamadali lahat ng tao. So nagre-rely na lang tayo sa vitamina. Pero kung magagawa natin ng paraan, sana mas maganda yung natural.
Salamat po.
One tip rin, no? Pwede mo rin siyang isama pag nag-grocery ka. Para nakikita niyo yung variety. There's madaming gulay, maraming prutas na pwede niyang pagpilian. At it's also bonding time for the mom and the child, no? Na pag sinama mo siya sa grocery, makikita niya na marami pang ibang pwedeng kainin na healthy instead of yung hotdog.
Saka pwede mo rin siyang isama sa pagluto mo. O ito, hiwain mo. O yan, halo mo na. Kasi pag ginawa niya yon, parang nag-participate siya doon sa preparasyon. Mas maingganyo siyang kumain.
Salamat po, Doc.
Salamat po. May isa pang tanong?
Magandang gabi po. Tatanong ko lang po sana kung may gamot po yung insomnia.
Insomnia. May insomnia po kayo? Okay.
Kasi po pag nag-pass ng 10, hindi na po ako makatulog hanggang umaga na po yun.
So after 10, anong oras po kayo nakakatulog?
Ano po, pag yung alas 10 na po, hindi pa po ako nakakatulog, dire-diretso na po yun. Hanggang umaga na.
Wow.
Kahit anong pikit ko po, pero gising pa po yung diwa. Pero po hindi naman po araw-araw, hindi naman po lagi. Minsan lang naman po.
Marami kang iniisip. O kaya kulang ka sa Biblia. Di ba pagka nagbasa ka ng Biblia, isang page lang, antok ka na. Sometimes kasi pagka natulog ka ng hapon, o late ka nagising, kaya hindi ka makatulog ng gabi na.
Hindi naman po. Kasi po minsan, hindi naman po ako natutulog ng hapon.
Kaya
Kasi
marami
po,
kang
nagtatrabaho
iniisip.
po ako eh.
Pero kasi ang insomnia, dapat lagi
Ano po?
consistent.
Siguro po sa iniisip ko.
Gabi-gabi, hindi ka nakakatulog.
Opo.
Yun ang insomnia. Kasi kung isang gabi lang, hindi siya labeled as insomnia.
Minsan po, sa loob ng 1 week, mga 3 gabi po yung sunod-sunod.
O kasi kung ang insomnia dapat tuwing gabi, hindi ka
dire-diretso po.
nakakatulog. Ganon.
Ganun.
Kasi kung nakakatulog ka naman, kasi alas 10 onwards, hindi ka na makatulog. Pagka before alas 10, nakakatulog ka.
ano po, pag nagpas na po ng 10
Oo.
talaga. Kaya kailangan po, mga 9, tulog na po ako noon. Medyo masarap na po yung tulog ko.
So yun nga po, kailangan i-maintain nyo yung normal sleeping pattern nyo. Kasi po pag naiiba, doon kayo nagkakaproblema.
Opo.
Isa pa po, kung i-take note nyo rin kung ano ba yung nakakain nyo o baka nakainom kayo ng kape nung gabing hindi kayo masyado mapagkatulog. So kung sa tingin nyo nakaka-apekto yon, iiwasan nyo po yung mga pagkain o mga inumin. Hindi lang kape, mga ibang soft drinks kunyari, meron din silang caffeine. So, iwasan niyo po yun kasi pwedeng maging cause din yun ng hindi kayo makatulog kaagad.
Thank you po.
Doctor,
Yan
you'd
lang
like to
po.
add?
Meron kasing sinabi sa amin na dati, nung nasa med school pa. Nasubukan niyo po bang uminom ng mainit na gatas sa gabi?
Ganun po ginagawa ko pag talagang hindi na po ako makatulog.
Talagang hindi ho.
Iinom na
Okay.
po talaga ako ng gatas kasi kailangan kong matulog.
Okay.
Po sa
Nakakatulong
umaga may
naman
trabaho.
po.
Hindi na po masyadong talagang
Siguro po marami lang ho talaga kayong problema.
Siguro.
Marami kayong iniisip.
Siguro po. Siguro.
So, okay na po. Sana mamaya makatulog na kayo.
Kasi ganun din problema ko pag lumagpas na mga 11, tuloy-tuloy na. Kaso,
Siguro nga po problema.
kung 9 o'clock, naantok na kayo, matulog na kayo.
Tsaka medyo normal pa kung one or twice, sabi nyo nga, hindi naman gabi-gabi, no?
Hindi naman po.
At saka, consider natin problema ang insomnia, lalo na kung kinabukasan, hindi ka na maka-function dahil hindi ka nagkaroon ng enough sleep. So, na-epekto na lahat ng gagawin mo for the rest of the day dahil napuyat ka, you did not have enough sleep.
Thank you po.
Salamat din at maraming salamat sa lahat ng nagtanong. And doctors, this ends our discussion. Thank you very much for joining us for 1 hour.
Congratulations for being 1 year.
Yes. Thank you very much, Dr.
Congratulations
Cruz.
on your anniversary.
Thank you, Dr. Cruz. Dr. Labella, thank you very much for joining us tonight. Join us again next week in the all-new season of MedTalk, a new format, longer time slot, and extended discussions on the benefits of good health and fitness. See you again next Tuesday on MedTalk, 7 p.m. on your scheduled on-air consultation here in our new home, Channel 9 on the Solar News Channel. This is Angel Jacob. Good night.
MedTalk would like to thank the following partners: San Juan City Vice Mayor Francis Zamora, the Department of Health, the Philippine National Red Cross, El Mayor Pharma Incorporated, ATC Healthcare International Corporation, your trusted life ally, Gamot Publico, Ascorbic Acid Saline, Pamanang Proteksyon, and Gardenia Bakeries Philippines Incorporated.